Hey everyone, this is Daily Dose of Medicine. Today we will talk about leg swelling, lower extremity edema. It refers to the abnormal accumulation of fluid in the tissues of legs, which can be unilateral or bilateral. It can affect one side or both sides. It can be pitting or non-pitting and acute or chronic. We will talk about the causes of each manifestation. Chronic venous insufficiency is a leading cause. It's the most common cause actually of lower extremity swelling, especially in older adults. It typically presents with edema that worsens throughout the day. It proves with leg elevation and may be accompanied by skin changes like hyperpigmentation, changes you see here, and lipodermatosclerosis and varicose veins. Here we have example of lipodermatosclerosis. It refers to hardening and discoloration of the skin and underlying fatty tissue, often leading to an appearance called inverted champagne bottle. Here you have an example. Is medication-induced edema, particularly seen with calcium channel blockers. Medication called amlodipine, which is probably most common hypertension medication, causing peripheral edema without fluid overload. This type of swelling usually affects both of the extremities. It's pitting and not associated with systemic symptoms. Recognition of recent medication changes is key. And other types of medication that can cause leg swelling include gabapentin, pregabalin, pioglitazone, rosiglitazone, non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, naproxen, and estrogen-containing birth control pills. Heart failure is another common cause, often present with bilateral pitting edema, elevated jugular venous pressure, hepatomegaly, enlargement of the liver, and sometimes ascites, fluid collection in the belly. Lymphedema, also characterized by non-pitting, often unilateral. It affects usually one side and it's non-pitting and may show skin thickening or hyperkeratosis. We have a sign called Stemmer's sign, which is inability to pinch the skin on the dorsum of the toes. Mostly we check with the second toe. It's specific for lymphatic dysfunction. Obesity, idiopathic cyclic edema can cause dependent, often bilateral swelling, especially in women. And idiopathic edema is associated with cyclical weight gain, nocturia, which is waking up one or more times during the night to urinate and is often exacerbated by upright posture. We have hypoalbuminemia, which is low levels of albumin, which is a type of protein in the blood, usually due to cirrhosis. It leads to edema due to decreased oncotic pressure and portal hypertension. And we have associated findings with this condition like ascites, jaundice, and stigmata of chronic liver disease. Nephrotic syndrome or renal disease presents with gravity-dependent edema, periorbital swelling, which we see here, and maybe associated protein in the urine and hypoalbuminemia. Deep vein thrombosis or DVT presents with unilateral swelling, one-sided swelling, pain, and sometimes erythema, red discoloration. Compression ultrasonography is the first-line diagnostic test that we use to diagnose this condition. Another common one would be cellulitis or necrotizing soft tissue infection. It presents with erythema, warmth, tenderness, and sometimes systemic symptoms. We sometimes use imaging and laboratory markers like WBC, CRP, sodium, help differentiate cellulitis from other causes. When we evaluate patient with lower extremity swelling, always good to check medication history, especially calcium channel blockers, like we said, amlodipine, and NSAIDs like ibuprofen, onset, duration, and progression of the swelling, associated symptoms like dyspnea shown as a graph, chest pain, fever, skin changes, and nocturia. Physical exam findings, whether it's affecting one side or both sides, pitting versus non-pitting, skin changes, and abdominal findings like ascites, CBC, albumin, renal and liver functions, urinalysis. They're important. Compression ultrasound through DVT, for example, echocardiogram to diagnose heart failure, MRI and CT can be used in infection, and sometimes if you're expecting compartment syndrome, which is another rare cause of lower extremity swelling. Special signs like Stemmer's sign and abdominal jugular reflex could also be helpful. Thank you so much for watching. Please join our channel membership to help our channel, and I'll see you on the next one.